Therapists, psychologists, psychiatrists, what are they? Hey thinkers, it's Jess, a licensed therapist specializing in both mental health and addiction. The professions I just mentioned are all professionals that work within the field of mental health, but they have different roles or qualifications. Here are some of the distinctions between them. Therapist is a broad term that encompasses many professionals that work within the mental health field. They may have different licensures such as LPC, LADC, LMFT, and LCSWs, but they are all master level therapists here in the United States. To become a licensed therapist in the United States, you have to have a master's degree. Licensure types has a focus on a specific population. LMFTs, which are licensed marriage and family therapists, tend to work with families and relationships. LPCs, which is a licensed professional counselor, is a general license that is a catch-all. LADC, which is a licensed alcohol and drug counselor, tends to work with substance abuse. And LCSWs, which is a licensed clinical social worker, is also like an LPC, but their degrees in social work, where an LPC, LMFT, and LADC have a degree in psychology. If you see any of those acronyms, they are licensed professionals that can help you with a wide range of different problems and issues. Psychologists are professionals in the mental health field that have earned a doctorate's degree, which can either be a PsyD, which is a doctor of psychology, or a PhD, which is a doctor of philosophy. PsyDs are a newer doctorate's degree compared to a PhD, which is more common, but both of them you can become a licensed psychologist. Licensed psychologists also have multiple schools of studies, just like master level therapists, but their licensure type is just one, which is a licensed psychologist. Psychologists tend to do research, perform psychological testing and assessments, which is known as psychometry, and they can provide therapy services. They can also specialize in different fields such as clinical psychology, counseling psychology, forensic psychology, and neuropsychology. To become a neuropsychologist, you have to have additional schooling beyond a doctorate's degree, which is called postdoctoral education. I want to take this moment to advise that master level therapists can also administer assessments just like doctorate level therapists. The caveat being that a doctor level therapist can administer all levels of assessment, where a master level therapist has a restriction on the types of assessments that they can administer. Therapists can give a wide range of assessments, but doctorate level therapists can give all of the assessments, and some of those assessments that they can give that master level therapists cannot give are more complicated. Psychiatrists are medical doctors that specialize in mental health. They have completed a medical degree, either an MD, which is a medical doctor, or a DO, which is a doctor of osteopathic medicine. Psychiatrists are qualified to treat and diagnose mental health conditions and prescribe medication. I want to also mention that master level and doctorate level therapists can also diagnose mental health conditions. Now, psychiatrists can also provide therapy, but their primary focus is on biological and medical aspects of mental health. Psychiatrists often work with individuals who have a complex and severe mental health condition. Now, these rules pertain to the United States, and it's worth stating that psychiatrists are typically the ones that prescribe medication. However, there are nurses that are also trained to prescribe mental health medication. This is becoming really common in the US because there is a shortage of psychiatrists. These nurses have additional training in psychiatric disorders and can also get doctorate degrees. Master level therapists cannot prescribe medications here in the US. There are very few states in the US that allow psychologists to prescribe medication. To my knowledge, there's only 6, and those psychologists have to undergo additional training to be able to prescribe mental health medication. The number of states in the US that allow psychologists to prescribe mental health medication may grow as we're moving into the future, but as of right now, you're going to have to go to a medical provider to get your medication needs met. What's your experience with therapy and medication? Let me know in the comments below. Have you found this video beneficial? Be sure to give it a like so it can get in front of the people that need it the most. Be sure to click up here for a video. Who knows what it might be, but click and find out if you want to watch more of my content. As always, stay positive and take care of yourself.